Hi there. Thank you for tuning in and for sending your questions. I'm Dr. Clelia Lima, nurse practitioner with a passion for wellness. Our topic today will help you understand some very odd factors about urinary infection. Actually, I'm going to give you 5 odd facts that maybe you didn't know about urinary tract infection. So, the five odd facts, I'm going to tell you the 5 of them and then we're going to describe them, okay? UTI can be treated without a urine test. Number 2, back pain can be a sign of UTI. Number 3, UTI can present without any urinary symptoms. Number 4, UTI can cause mental confusion. Okay. And the last one, number 5, sexual intercourse can prevent UTI. So let's see what this goes. And also by the end, I'll give you an update on COVID and the new vaccine coming our way and what's going on. Okay. So first, let's define what is urinary infection. The medical term actually is urinary tract infection. So most known as UTI. Most people know, oh, I have a UTI, right? So most people know UTI. So the full thing is urinary tract infection. It is actually is an infection of the urinary tract that includes more than just the bladder, because sometimes people don't realize. So the whole system is the urethra that goes from the outside in, and then you have the bladder, and then divides in 2 ureters, and then the 2 kidneys. So the whole tract is goes from outside the urethra, the bladder, and then goes up to the ureters and then the kidneys. And the urinary infection can happen any part of that urinary tract. Most of the time, the UTI, the bacteria, is located in the bladder, most of the time. But sometimes it can migrate all the way to the kidneys, which is very complicated. So when the bacteria goes up to the kidneys, the symptoms are more severe. So you may have fever, chills, nausea, vomiting. So usually you need treatment right away because it's severe. So UTI is most common in women due to the anatomic design, because the urethra is so short and it's close to the vagina and the rectum, so it's easy for bacteria to migrate to the urinary tract. So, but men and children, they have urinary infection as well. But those we have to have more detailed treatment and assessment, because it could be other things. So it's important to pay more attention when it's a man or a child. So as you may know, our bodies, we have bacteria in some parts of it. Our skin, we have bacteria in our skin, all the time. In our gut, some parts, nose or mouth, you have bacteria there. And we kind of, we coexist very friendly. The problem is when those bacteria overgrow, or when they go places that they should not go, like the urinary tract infection. You should not have bacteria in any part of it. So that's a way to pay attention that it could happen, and then we're going to see some odd factors, and then we're going to discuss how it happens. So before we get into the 5 topics, I'm going to give you very common symptoms of urinary infection. So most common is pain and burning when you pee. Sometimes you have frequency and urgency. You have to pee, you have to go right away, and then you pee just a little bit, and then you have to pee again. Sometimes you have foul smelling in the urine, sometimes pressure or discomfort in the public area. So, passing small amount of urine in frequency and pain, those are very classic symptoms of urinary infection. But just keep in mind that you can have different symptoms as well. Those are not the only ones, and we're going to talk a little bit about that. So the number one odd fact about UTIs is that you can be treated without a urinary test. And I know some people, they just run to say, I need to know what is my urine. I need to, but the test that you do, the rapid test that you do in the doctor's office, it's very simple. It's not reliable, actually. So I have had patients that come in and they have all the symptoms, the pain, the burning, and the frequency. And then we do the urinary test, negative. You don't see bacteria, you don't see any signs of infection. What do you think? Those patients, they need treatment because we don't treat the test, we treat the patient. And that's what we learn. History is 80% of the diagnosis. So we may send the urine for culture, but the patient needs treatment. So you can treat an UTI without doing the test because you would treat anyway by history alone. So there was a very interesting question here. So if you gonna treat with antibiotic anyway, why can't I just go and buy over-the-counter antibiotic? Well, first of all, in the US, you cannot buy over-the-counter antibiotic. You need a prescription. But some people, they may say, oh, they have come to me like that. Oh, I took some antibiotic from my cousin or some antibiotic that I had left over from another prescription and didn't work. Yeah, because you take an antibiotic that was not prescribed for you for that particular symptom. So very dangerous to take antibiotic without a full assessment from a health professional, because that could be very detrimental for your health. So I'm going to tell you something about subclinical urinary infection. Subclinical means it's there, but you don't see it. If you do the test and you don't see it. So subclinical means you have to listen to the patient. So when you do an assessment, you don't just say, oh, that's urinary infection. It's an easy, visit. You have to ask the right questions. It's important to know how many urinary infections the patient had in the last year. Because if you had 2 infections in 6 months or 3 infections in 1 year, that's high risk for bacteria that are resistant. You may have other problems with your urinary system that is not a simple UTI. So it's important to know. It's important to assess if you have any allergies to medication, if you take any medications on a regular basis. So the antibiotic that you're going to decide to prescribe is effective and doesn't interact with the other medications. Also, it's important to know if you have diabetes, if your sexual activity, what kind of environment you are dealing with. Because if you have blood in the urine, if you have fever, if you have chills, it might be an indication that you have the infection migrated to your kidneys. So it's a lot of things that it's important to assess before the healthcare provider actually prescribe the medication. And also history. If you have a history of kidney stones or kidney infections in the past. So the decision make has to do with your gender, your your age, very important to know that too. So those are things that many times people don't realize that, goes into the whole decision making. So another question here. If I have taken antibiotic recently, can I take the same antibiotic again? Well, that's a no-no. Because if you had antibiotic for whatever reason, it could be even for another kind of infection, usually you will not be prescribed the same antibiotic to prevent you getting antibiotic resistance. So that's also part of it. Also, the duration of the treatment, the kind of treatment, like, most of the UTIs are E. coli that is found in the colon. And for that particular, common bacteria, we have several antibiotics that we can treat the patient with. So it depends on the situation, will be a different prescription and the duration of the prescription as well. Sometimes you may need a referral to see a urologist because, from the whole assessment, like, it looks like you need something more specific that a urologist may be the best option for you. Sometimes you need to send you to do a culture. So, each situation is different. Many factors play, a role in just, make sure that you get a well-trained and experienced healthcare provider to do your assessment and your treatment. Topic number two, back pain can be a sign of UTI. It is true. Sometimes the person has no other symptoms but back pain, especially if the pain goes to the flanks. Sometimes just one side, or could be both sides, which is located pretty much, close to your kidneys. And that's a sign that your infection has migrated up to the kidneys, which is very severe. It has a fancy name, pyelonephritis, but actually that's what it is. The infection went up to the kidneys. Usually people have fever, chills, nausea, vomiting, and you should seek medical attention right away because that could, have very severe consequences, including problems damaging your kidneys, So you don't want your kidneys to be functioning the poor, level. You want your kidneys to be strong and healthy. So if you didn't know, back pain could be a sign of UTI. Number three, UTI can be present without any urinary symptom. Yes. And this is very dangerous, actually, because then the person doesn't seek treatment because was not feeling anything. And then it could be an UTI that is getting more severe. So usually people that don't have any symptoms, they find out that they have UTI because they did a urinary test for something else, a screening for a scheduled surgery, or if you're pregnant, most likely your OB going to be doing regular urine check. And so you need treatment. If you go to a hospital ER, in the emergency room, whatever reason you go to ER, they do a urinary test because it's so common to find things that you need to treat, even if you didn't go for that reason. So if you don't have any symptoms, you still may need treatment. But it's a kind of complicated, this topic, because there are symptoms, there are situations the patient doesn't have any symptom, but they have the bacteria, but it's colonized. And most of the time, those patients are admitted to the hospital. Or if they have a urinary catheter for long term, they may have bacteria in the urinary tract that is colonized. In those cases, you don't need to have treatment again because those patients, they have been, to very to many rounds of antibiotics, so you don't treat again. So it's kind of, that's when we go to medical judgment. Topic 4: UTIs can cause mental confusion. Oh my gosh, that's one of the scary ones. So actually, any infection can cause mental confusion, but urinary infection is one of them, because infection can damage your nerves and your brain cells. So that causes mental confusion, disorientation. In rare cases, untreated UTI can lead to sepsis, which is a generalized infection affecting your organs. And in those cases, you need to be admitted to the hospital to have intravenous antibiotic. So luckily, those are rare. So it's not like, you're going to see all the time. So the likelihood of getting UTIs increases with age. So especially if you are over 65, it may be related to difficulty emptying your bladder, because you may have other health conditions such as enlarged prostate, bladder prolapse. So those things might contribute to difficulty emptying the bladder and increasing the risk of urinary infection. And older people may not have any symptoms for uh, urinary infection, and then they delay treatment and raise the chance of mental confusion. So people with dementia and psychiatric disorders, they may trigger behaviors such as agitation, withdrawals. But fortunately, once the UTI is treated, the mental status come back to the baseline. So it's treatable, and most of the time people do well. So it is, mental confusion, one of the odd facts about UTI. And the last one, the number 5, sexual intercourse may prevent UTI. Usually you hear that too much sex may cause UTI, which may be true. However, regular sexual activity may help prevent UTIs in menopausal women. So some women have vaginal atrophy due to the hormonal changes, increasing the risk of UTI. So sexual stimulation helps increase blood flow and vaginal secretion, keeping the tissues healthy and decreasing vaginal dryness. So, of course, if your menopause symptoms are more severe, you may need hormonal replacement and other treatments. But this is just one interesting fact that many people don't hear about, that, the sexual intercourse may help to get all this system healthier and then less likely to have urinary infection. So those are interesting things that I hope that you enjoyed. But I couldn't finish without telling you just a little extra bonus prevention, how to prevent UTI, at least the risk of getting UTI. So avoid diaphragms, spermicidal jelly, vaginal douches, tight jeans, nylon underwear. Because many times you see people that are doing things of lifestyle that is, causing UTI. Now, things to do. Number 1, I know you guessed. Yes, drink water, 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 water. Hydration, number 1 for health in general. And for UTIs prevention, yes, please. At least 2 to 3 liters a day, which is like 70 to 100 ounces a day. Personally, I drink more than a gallon a day, which is more than 4 liters. And before I start my day, just getting ready for the day, I drink at least 1 liter of water. Water, water. So very important to hydrate yourself for your urinary tract health and for your health in general. Wear cotton underwear, breathable, okay? That helps too. Change underwear after exercise. And that's amazing how many people don't. I have had many patients coming in with UTI, and they say, "Oh yeah, I went to the gym and then I went to, to the mall. I went shopping, blah blah blah." Wait, wait, wait. Change your underwear when you right after you exercise, because you want to make sure that It's all nice and fresh and moist. Loose fitting clothes. Pee as often and as soon as you feel the need. So many people hold their pee because they are working, they are busy, they don't have time to go to the bathroom. And then you're going to have time to have an infection. Not a good idea. So if you need to pee, go pee. And then when you pee, make sure that you empty your bladder. It's amazing how many people are in a hurry, they pee just a little bit and go. Like, make sure that you pee, completely, okay? Women, wipe from front to back. And that's a very good, it's a very important habit, because from front to back, you are not giving a chance to bring bacteria from the rectum. And E. coli, remember, is the most common bacteria for urinary infection. It comes from the rectum. So front to back. And if you have a chance, I know sometimes it's difficult, but if you have a chance to wash yourself after you go to the bathroom, that's the best. So pee before and after sex. So how does it work? If you hydrate yourself really well, you're going to have a chance to pee and empty your bladder before you have sex. And then after you pee, you drink a big glass of water. And with the sexual activity, your metabolism goes faster. You're going to have the urge to pee after you have sex as well. And peeing after sexual intercourse is very vital, because the urine is acid, and then it just flush out any bacteria that could be wanting to migrate up on your bladder. So flushing out is a good idea. So the last thing here is supplements, cranberry, products, probiotics, vitamin C. Some people feel the benefit of supplements. We talked about this before. Supplements are not regulated by FDA. They are not medications. So there is no guarantee that they're going to work one way or the other. But some studies, small studies have shown benefits. Some people feel benefit. So if you like and you want to take it, you can take it. So that's all for our topic today. I want to give you a little bit of the updates on the pandemic, what's going on with COVID. All in all, it's good news. The cases and the hospitalization is going down in the US in general. Most states, they have lifted some of the restrictions, including use of masks. Personally, I prefer to use masks in places that are enclosed, that I don't know the people, if they've been vaccinated, what kind of activities they do. So I think we got used to masks. I don't know, but personally, I'm going to wait a little bit more before I just open up and don't use masks outside, in closed places. But it's all good news. People are getting more exposed to the virus, either by getting natural immunity, by getting exposed to the virus, or getting the vaccine and the booster. So Omicron is all over the place, but I haven't had COVID yet, and I hope that I don't. So I'm just keeping cool and doing my precautions, because even though it's not very severe, the Omicron symptoms, I hear a lot, and I have seen a lot of long COVID, mental issues due to COVID. So I prefer, to keep away from it. But, it's all over. There is no guarantee. So the treatments available are more available now: the Molnupiravir, the Paxlovid, which are the pills, oral treatment for COVID if you get COVID. Also, the vaccine that is still, I don't think it's approved yet. The Novavax is another option for people that don't want to get the mRNA vaccine. So lots of options out there, lots of good news, because it's getting better. If you need a consultation for COVID or for anything else, I'm here for you. Please subscribe to my YouTube channel, like my videos, and share with your friends. See you next Tuesday for another live Q&A. Keep moving towards your best self. Be healthy and feel well.